Do I really want to know if I have circulating tumor DNA? I am Lauren Cranmer and I am a breast cancer while pregnant survivor, and I share all the things giving back to you, sharing my story, sharing the knowledge that I have to help you, and just kind of sharing my life about, living in breast cancer survivorship as a mom, as a person who has many interests and just wants to live their best life. And that's why I'm here. I'm here to share my pro tips of having experienced it and giving it back to you. And today I just feel like I need to catch up a little bit because I have been so busy. I've been so, chaotic in my head, chaotic with the kids and life and busyness. It's just been crazy. So my priority has not been YouTube, but that's where my passion is. My passion is here, sharing my experiences for you and sharing my knowledge for you. So I kind of just wanted to give a little touch base video of where I have been. My dog is drinking his water. A couple things that I've experienced in the last few months that are kind of things I'm excited to share because I was unaware of these things, and I feel like if you were in similar shoes to me, maybe they could benefit you in some way. So the first thing is, since I have had a hormone positive cancer, I am in a forced menopause. Now, forced menopause is just what it sounds like. It's forced. So my body doesn't want to be there, and it's going to try to get back to a base state of normalcy if I were to stop my medications. My medications are what are keeping me in menopause. Sometimes anybody's body can work harder than the medications. So this is not your body's base state. This is not how my body wants to work. So a while ago, I had asked my oncologist if it was beneficial to test my estrogen because, hey, we want it to be low. Why wouldn't we want to test it, He agreed to doing the estrogen levels, and we did it, and they were low, and then we did it again, and it was kind of like a little bit all over the place, but all still fairly low, but still just low and like raising a little bit over time. So obviously that got me concerned. My oncologist actually recommended doing an ultra-sensitive estrogen test. So we were just doing a basic estradiol, which apparently there's an ultra-sensitive test, which I didn't know anything about. And I didn't know anything about that. It's okay to ask to check your levels. I'm not trying to give medical advice. This is just my personal advice that for a peace of mind, you would maybe want to have your estrogen levels checked. So if you feel like, hey, I feel like my body is being weird and I just don't know what it is, why not check your estrogen? It doesn't hurt. If you can, try it. Another thing that I did in the past few months was decided to get circulating tumor DNA blood work. Now mine, I know there's a couple out there. There's Signatera, and then there's Guardant Reveal, which is the one I did. Now my oncologist told me about this months ago. He told me at the end of last year. And when he first told me, he's like, hey, this blood work test to see if you have any cancer cells in your body. It tells you if you are more likely to have a recurrence in the future, but it doesn't tell you if that's in the near future or in the far, far, far future, or doesn't tell you any time. It could just say yes or no, and you just kind of have to deal with that answer. So at first I was like, do I really want to know if I have circulating tumor DNA? Because then what? And he pretty much said nothing would really change at that point. We'd kind of assess the situation and take it from there. It would just mean that I'm at higher risk for getting a recurrence. And it's like, I just didn't know if I wanted that answer or not. And obviously I would want the no answer. I'd want it to say nothing, but what if it was positive? So I sat on that for months, just kind of deciding what I really felt comfortable with. And ultimately my decision was that if it came back positive, I think I would feel the same, because I already feel like I am at greater risk. I'm at higher risk for a recurrence. I've had lymph nodes involved. It was a stage 3A cancer, and that's a later stage of cancer. And I had 7 lymph nodes positive. I had all the things. I was hormone positive, HER2 negative, all these data points that led me having a higher risk. So I already kind of assumed that I was probably going to get it in the future, If this test came back positive, it would just kind of confirm that and keep me where I was at. And if anything, it would give me more drive to push for like being more aggressive with testing and any new weird thing in my body. Maybe I would go to the doctor for a little bit more seriously, which I don't think that's a bad thing. So needless to say, I got the blood work. And I am very happy to report, just to get to the chase, that it was 0%. The big old goose egg. It was 0. I had no circulating tumor DNA on the result. And even saying that, I just feel elated. I feel relief. And now this doesn't mean that I don't think I have a risk of recurrence. I do. But what this means is that it did not detect cancer DNA lingering in my body, whether it was dormant or not. So this is a really great start for me. This is a really great place to be at this point in my journey, because we all know that the first couple years are the highest risk of recurrence rates, and you kind of are watched a little bit more heavily. So I am still within that window, and knowing that it was 0 is just, I felt like a new person, and I felt like I could breathe a little bit. And I don't feel like I'm free, but I do feel a little bit more at peace, and I recommend doing it. Obviously I had the result I wanted, and so sure, I'm biased, but I think having that information is beneficial. And obviously you make what decision is right for you, but I think we're gonna do it every 6 months or so, and just to see if we stay at that 0%, because obviously we want to do that. Apparently it doesn't have, it's not like a yes or no, it's a percentage. So you could have like 5%, you could have 19%. I don't really know how they dictate the percentage, but I'm okay with 0%. Let's just say that. Also, I did a video that I was officially diagnosed with lymphedema. That was a thing. I'm still in PT for it. I've had significant reduction in the size of my arms, so it's been super successful, and I've been doing the right things. I plan to do a video on lymphedema and things to do for it, and for preventative measures and all the things I've learned from PT, so keep an eye out for that. I'm gonna buy nipples. Yeah, I don't have those. I just have scars, and I think it's time that I dabbled with the stick-on nipples. And I'm obviously not going to do like a full-on review video because I don't want to show you the girls, but I am excited to see how that works and how it makes me feel, because I think that is the reason that I want to do it. I want to see how I feel with nipples that will not look familiar to me, but I am excited to just kind of play around with it and see how it goes. I've heard really good things, so there's that. Oh, another thing is I kind of wanted to just say hi to a breast cancer survivor, or say hi to somebody that you think might be a survivor, and take that risk and putting yourself out there, and I guarantee you will be happy with it. Every time I've done it, every single time that I've reached out in person to somebody who was either who has indicated in some way that they either are or know a survivor. They wear a pink ribbon, might have a head wrap or something of the sort. Reaching out has always been mutually beneficial and surprisingly emotional, and I think after I'm done with that interaction, I'm always extremely grateful for it. So if you're ever hesitant to approach somebody, just do it. What's the worst that could happen? I think just let go of all expectations, and I think you'll be surprised at what you find. So just giving you that little nudge to take that step, because I know we've all thought it. Just wanna like, hey, like, I know where you've been, you know, kind of do it. I do also want to just kind of mention the stage that I'm at in survivorship is pretty interesting, because in the beginning of survivorship, when I was just getting out of treatment and trying to heal, like that's all I focused on. I wanted to heal. Mind, body, soul. I was focused. I wanted to eat right. I wanted to do the right amount, if not more, of exercise. I wanted to mentally be at peace. I wanted to just feel good and be at peace. Those were the only goals, was health and peace. Health and peace. That was all that was running through my head. And now I have other goals, including those things. And I feel a lot more balanced, although things are getting a little chaotic because there's a lot going on. And it's really nice. Like, it feels different from before cancer, but also kind of like a normal human where I'm not solely dedicated to healing from cancer and this trauma or this traumatic thing I've been through. I just feel like I'm leading this life with this new intention, and I just feel positive. I feel positive. I try to speak positive things. And don't get me wrong, things are crazy lately. My kids are crazy. They are amazing, but they never stop. They never sleep. They are angry little gremlins. But I'm just thankful that I'm even here to experience it. And it's okay. I also want to mention, it's okay to not be thankful. Some days I'm like, I feel miserable. Like, sometimes momming is really hard. Sometimes accomplishing all the things you want to do is impossible. And sometimes you just feel like shit, and that's okay. You don't always have to be appreciative, and you don't always have to be outright thankful for just being here. Like, that's just not logical. I will preach that I am thankful because I am, but that doesn't mean you have to feel that every day. So that is another thing that I really want to remind you of, is that you can be thankful and appreciative of the time that you have, but life is not perfect, and you don't have to feel that way 24/7. And you shouldn't get hard on yourself if you don't, because if you're feeling grateful and appreciative of everything in your life 24/7, something's weird. Life is hard. No matter how good or how bad you have it, life is hard, and whether it could be for whatever reason. So please don't be hard on yourself if you don't appreciate every moment. That is something that I think is pushed within the cancer community, or people who have experienced traumatic events in their life, like, oh, we should just be grateful now because, you know, we've overcome this tough thing. But the reality is life is still tough, even if it's minute things, even if it's things that aren't so drastic as cancer. You know, like, life is still tough. So you can be appreciative and still have tough days. And I feel like I just ranted. It is what it is. My camera died, so I'm on my phone now. So that being said, thank you again for watching. If this video is any help to you, please let me know in the comments. I always want to share and interact with those who are in similar situations to me, and just relate to one another, help each other out, do the whole thing. So thank you for watching, and I'll see you in the next one.